My name is Robin Barkins. I am a woman that has been living with HIV for the past 25 years. I've been working in the public health sector for the past 7 years around people living with HIV, individuals experiencing homelessness, and formerly incarcerated individuals. So what really made me get into this work and inspired me to get into this work, while I was incarcerated, I met some women that were living with HIV that came into the jail to educate women about self-esteem and how to just thrive and live with HIV and cultivate healthy relationships. So upon my release into treatment, it kind of inspired me to get to know more about HIV and how to become an advocate into the HIV space. I was a peer educator and a peer navigator for people who were diagnosed with HIV, who have been out of care or living in isolation. I lost my job due to budget cuts. At the time, my employer just told us we're not renewing the grant. Basically, we don't know where our other means of funding will come from, and we basically wish you all the best. That left me in a dark place. I was just recently grieving my sister that passed away a few months prior to that. We had to bury my sister. So I was still struggling with grief. And then the grief of my mother spiraling down with the dementia. And then the loss of my job on top of that. It took me to a really, really dark place of depression and alcoholism. Since I lost my job, personally, it affected me in ways to where I engaged in a little more alcohol use. I was isolated, deeply depressed. I had thoughts of suicide. And it left me, emotionally, spiritually, and financially bankrupt. We had built relationships with these women that depended on us for our emotional support, our peer support, accompaniment to doctor's appointments, to just help them navigate social services. And by us not being there, some women fell out of care and stopped showing up to different community engagements. Women who are diagnosed with HIV like myself, when the budget cuts came, I was skipping dosages in fear of me not having enough medication. So I told my doctor that if you see any changes in my labs, just know I'm skipping medicines, dosages weeks at a time, so I can stretch out my meds. So it was just fear of losing medications. Some people thought they were gonna die, they wasn't gonna make it. It was just everybody was in survival mode, including myself. Even the organizations went into survival mode, that they couldn't provide the normal services or the collaborative partnerships like we're used to. And we missed out on a lot of fellowshipping, I would say, when it was time for us to come together for different events and activities. I'm still searching for employment. These terminations has really still have been a barrier to my employment. So I kind of tried to pivot and go into the reentry space, but still try to connect the reentry and the public health space together to try to still give hope to HIV and prevention, and for women that may be exiting state prison that are living with HIV. But it has been hard for myself to find employment, even try to sustain myself. And one of the things that affected me during the termination period was just for a simple peer education program. They're requiring you to have a bachelor's degree, something that a person with lived experience like myself. I've been living with HIV for 25 years. I feel like with a peer specialist program, my peers will want to listen to me versus somebody just with a bachelor's degree that has no lived experience. So I think that has been really a tremendous barrier to employment as well. My hopes for the next steps and what will happen next is that we can reinstate our funding, open up more job opportunities for individuals such as myself and my peers, and we can be able to rebuild and gather again in this space. My fears into what will happen next is myself, like my medication might run out. I have enough bottles of meds to probably last me for another year because I've been ordering medication, trying to sustain myself. So I really been in survival mode for myself. It's just been like a SOS for me. Trying to stay alive in a sense and still have access to all my other medications because I don't only have HIV, I do have heart disease and high blood pressure. So I have to ensure that I still have access to the life-saving medications that I need for myself and also my peers. So I pray that everything can be restored back and we get some funding to where we could sustain our employment and also have access to life-saving medications.